Let's speak now with Professor Raina MacIntyre, who's a Professor of Global Biosecurity and the head of the Biosecurity Research Program at the Kirby Institute at UNSW Medicine. Raina, thanks for being here at this early hour on a Sunday. How freaked out should we be?
I think we should be concerned but not panicked. There's a lot of unknowns still. Most of the cases are still in China. There's about 1,400 cases now in China and about 41 cases in other countries, including 4 here in Australia so far.
What do we know about how the mortality of this virus compares to others?
So overall, it seems to be between 2 and 5%, which is less than what it was for SARS. But for people who are hospitalised, it's about 15%. And if you end up in ICU, it's almost 40%.
Is that uncommon?
Yeah.
That's also similar to SARS.
So it's basically a case of as soon as you feel the symptoms, immediately go to your GP.
Yes, anyone who's travelled to China should report their symptoms straight away. It's interesting, but a lot of the cases that are presented, not just here but in other countries, seem to have been sick for a few days, 5 to 6 days before they present. So it seems like it causes a mild illness for a few days and then becomes more severe.
Symptoms that would be the same as a normal flu?
Yeah, or a common cold even.
Right. Okay. And do we know about the infectious nature of how infectious it is during that period where it just feels like a common cold?
We know that it's transmissible from person to person in some cases, but we don't know what proportion of cases are spread person to person, and that's what we worry about the most, because that can then make it spread very rapidly across the globe.
You looked into the cumulative cases. You did a graph of it. What did you find, and does it point to any factors that have spiked, that have made the cases spike?
Well, the two interesting things were there seemed to have been a big surge in reported cases after January the 20th, and until about a few days ago, most of the cases were in the Hubei province, but in the last few days it seems to be about half the cases in the rest of China and half the cases in the Hubei province, which is why they've extended the travel ban in China to different regions. That's concerning because it means that people flying out of other cities could transmit the infection globally.
There's always a bit of a balance, I suppose, when you're considering an epidemic between the ability to contract the disease and then the swiftness with which the disease kills you. If it kills you very, very quickly, then you don't have any time to give it to anybody else. And if it kills you very, very slowly, then, of course, you can spread it around a lot. Do we have any sense of how that nexus plays out in this particular virus?
So from all the clinical details I've read, it seems like people are sick for a while and with a milder illness and then tend to present to hospital a few days in. So,
I suppose, is that good or bad news?
It's bad news because it means that
if other people without knowing it.
Yeah, if they are someone who can infect others. And interestingly also, there's been a documentation that children can have pneumonia on an X-ray but have no symptoms at all. So it's possible that children could be spreading it without being symptomatic.
Right.
Now, officials, this is something that I don't understand, of course. Officials are continuing to reassure the public not to panic, and they say that there's little risk that the disease could spread from person to person. How then is it spread?
Well, we don't know. We haven't really seen a good risk factor analysis and an epidemiologic study to understand how it spread. It was assumed that at the beginning most people, because they had contact in this seafood market, had contact with some animal source. So it looked like an outbreak where many people had exposure to something in those markets at the beginning. Subsequently, there's been a few cases documented and confirmed within families where there's been person-to-person spread. But what proportion of the spread is person-to-person versus from some other source is unknown at this stage.
What does the World Health Organization do now?
Well, I would imagine they would need to reconsider again. They met twice last week to think about whether they want to declare a public health emergency of international concern.
And what happens if they do?
Well, it gives them more authority to assist with disease control efforts with different countries under the international health regulations.
When you see sort of airports undertake some of these things, like they'll have temperature controls, and as you walk past, you can see a little red imaging map of your body and so on at some airports. How useful is that in combating something like this?
It depends on the disease. So in a disease like influenza, where you get a lot of transmission when people don't have any symptoms, it's not very useful. In diseases where most of the transmission occurs when people have florid symptoms, like Ebola and SARS, it's more useful, but it's not foolproof, because people can be incubating the disease and come into the country and develop illness later.
And you're saying that in this case it seems like the former.
We don't know.
The less useful case.
We don't know.
But you were saying
seen
earlier
the
that
data.
it seems like people can be sort of slightly non-symptomatic and can go quite a few days with something that just seems like a cold.
Yes, so, but we haven't seen the data. We really need to see a detailed analysis of these kind of things to be able to be more conclusive about it.
There's talk now about a race for a vaccine. Does that spark panic at all? I mean, should we be looking for a vaccine now, or is it a case of we should really be waiting this out? Because most of the deaths are in China rather than outside of the rest of the world.
There is already vaccine being developed with the National Institutes of Health in the US and other groups. There was a vaccine developed for MERS coronavirus, and maybe there's some work looking at what sort of cross-protection that has, or whether it can be adapted for this. But vaccines, you can control an epidemic with other measures as well while you're waiting for a vaccine. And the most important is identifying cases really early and isolating them, tracking their contacts, watching the contacts to make sure they don't get sick, and protecting healthcare workers, because we've already had one documented healthcare worker death in China, and in SARS 21% of all the cases were in healthcare workers. So these infections, the coronaviruses, tend to have a heavy toll on healthcare workers.
Okay. Professor Raina MacIntyre, thanks so much for coming in.
Pleasure.
Great to talk to you.